balance. First of all, the rule of the bees. If the pH and the bicarb are both in the same direction, then it is metabolic. If the pH and the bicarb are both in the same direction, then it is metabolic. So these are rules. They're going to help you answer questions correctly. So when you get an ABG question and they say, what type of acid-base balance is this? And they give you the numbers. You say, well, what's the pH and the bicarb? If they're both in the same direction, then it's metabolic. So let me explain to you how you use this. So examples, do you see where it says examples under that gray box? It says normal. So what's normal pH? 7.35 to 7.45. That's normal pH. And then the normal bicarb is 22 to 26. That's normal bicarb. If you learned other numbers, these are the numbers you need to know for NCLEX. If you work at a hospital where they give you slightly different range, when you're at your hospital, use the range they give you. For the NCLEX, use these numbers. All right, so let's explain how this works. So you see where it says A, pH there? So here we have a pH of 7.30. Now, we teach very conceptually. We teach in terms of concepts rather than just straight facts. There's facts you have to know, which is why you have a blue book. And there are some facts you have to know, but you also have to understand concepts. So the pH of 7.30, is that up or down? Is that up or down? Well, it's down. So put a down arrow next to that. Now, if the pH is low, what is that called? Is that called acidosis or alkalosis? That is called acidosis. Okay, so the pH of 7.3 is down, and that's acidosis. Then the bicarb, HCO3, the bicarb is 20. Is that up or down? Well, that's also down. Okay, so we know we have an acidosis here, and the pH and the bicarb are both in the same direction. And if the pH and the bicarb are both in the same direction, then it is what? Metabolic. It is metabolic. This is how you use this rule. If the pH and the bicarb are both in the same direction, then it is metabolic. Let's do another one. Okay, pH 7.58. Is that up or down? 7.58. Well, that is up. So what's up? When the pH is up, what do we call that? Call that alkalosis. All right. And then the bicarb. The bicarb is 32. All right. Is that up or down? Well, that's up. So the pH and the bicarb are both in the same direction. When the pH and the bicarb are both in the same direction, then it is what? Metabolic. So this one's metabolic alkalosis. Okay, one more example. pH is 7.22. Is that up or down? Okay, you're right, that's down. So we say, well, that's acidosis. Okay, and then the bicarb is 30. Is that up or down? That's up. So the pH and the bicarb are not both in the same direction. So it's not metabolic. Well, if it's not metabolic, what is it? It's respiratory. That's how Mark says it. Mark says respiratory. So I want to give you the true Mark Klimek experience. Respiratory acidosis. You may say, Sharon, are you telling me I don't even have to look at the CO2 or the O2? That is exactly what I'm telling you. When we're talking about acid-base balance, we are talking about the pH and the bicarb. If they are asking you about respiratory failure, then you can look at the CO2 and the O2. The ABGs tell us more than just acid-base balance, right? They tell us oxygenation status. Oxygenation status isn't acid-base balance. The pH and the bicarb are acid-base balance. That's what you have to look at for acid-base balance. Now, the whole point of compensation is to get the pH back to normal. It says they're never choose compensated if the pH is abnormal. So by definition, if the pH is abnormal, by definition, that means uncompensated. Means it's not compensated if the pH is abnormal. If the pH is normal, it is compensated. That's what compensation means, because our bodies do not function when our pH is high or low. It just doesn't. For whatever reason, our body functions best when the pH is 735 to 745. That's when all our biochemical processes, potassium moves across the alveolar capillary, potassium moves across the cell membrane, oxygen moves across the alveolar capillary membrane. Everything works the way it's supposed to work when our pH is 735 to 745. When it starts going up or down, all those biochemical processes that keep our muscles moving and our heart pumping and our brain functioning and the neurons transmitting, all that stuff starts to go wackadoo. All right. So that's why we like to see the pH there. When the pH is off, we're like, uh-oh, that's not good. Okay. So never choose compensated if the pH is abnormal. Now, if all three are abnormal, then you can choose partially compensated. Now, having said that, that is not Gazelle at the back of the pack information. Okay, compensated is not, or partially compensated is not Gazelle at the back of the pack information. The reason we put it in here is because a lot of our students kind of freak out about it a little bit, because they're like, but I have it in UWorld, and UWorld has all these compensated questions. Okay, all right, fine. So something to think about, fine. And this is kind of basic. If you need to know anything, this is really all you need to know about compensation. Okay. So other than that, I wouldn't worry about it too much. All right. So if they ask you an acid-base question, and they will use either, well, they'll use the word acid-base. They'll use the word acid-base in the question, and then they'll give you the numbers. Or they'll either give you the numbers in the question, or they'll give you the numbers in the answer. If they give you the numbers in the question or the numbers in the answer, and they ask you what acid-base imbalance it is, you're going, okay, the pH and the bicarb are both in the same direction as metabolic. But what if instead they're not giving you numbers? They're giving you symptoms. So instead of that, they say your patient is experiencing metabolic acidosis. And then they say, what signs and symptoms would you expect, or what signs and symptoms would you watch for? Well, the rule of the bees isn't going to work for this. Okay, so the next rule, the bottom of page 1, this rule here works with this kind of question. All right, so here's the rule. This is the second rule. As the pH goes, so goes my patient, except for potassium. As the pH goes, so goes my patient, except for potassium. This is the second rule. And I really like this rule. I use this rule all the time, actually, even in clinical settings, because if the patient's pH is going down, do you know what the patient is doing? They're going down, y'all. The patient is going downhill if their pH is going down. So it's really a good concept to remember. And in clinic reviews, we like up and down concepts. We talk about, you're going to find as we go through this, we're going to talk about up and down concepts a lot, because up versus down is a concept everybody can understand. And when Mark sees patterns, a lot of times the pattern he sees is an up pattern or a down pattern. He's like, oh, all those things are going up. Oh, you're right. I never noticed all those things were going. All those things are going down. Oh, you're right. I never noticed that, right? So we talk about up and down all the time. So as the pH goes, so goes my patient, except for potassium. So let me help you understand what I mean by that. So let's talk about up. Now, if the pH is going up, what is that called? That is called alkalosis. Okay, so that's a pH greater than 7.45. Okay, so that's what we're talking about. If the pH is going up, then all the signs and symptoms are up except for potassium. So don't forget the potassium. So the signs and symptoms are up except the potassium is down. Okay, so we're watching for hypokalemia. Now, all the other signs and symptoms are up. So what do I mean by up? I mean words that mean up. Like anything that starts with the word hyper is an up word. Anything that starts with the word tacky is an up word. How about this word? Elevated. That's an up word. How about rising? How about spiked? Do you see how all these are up words? So what we're saying is all the symptoms are going to be up symptoms except for potassium. So I'm just going to give you some more examples. This is not an exhaustive list. We do not like you to memorize lists because lists are almost impossible to remember for any length of time. So we don't like you to memorize lists. We like you to remember concepts. That's why we like up and down concepts. Okay, so let's talk about up symptoms. Again, it's not an exhaustive list. I want you to think conceptually. So how about this? Tachycardia. How about rising blood pressure? Pressure, that's supposed to be U-R-E. My handwriting is terrible, apologize. Okay, tachycardia, rising blood pressure. We could say hyperreflexia, or, I mean, they don't have to say that. They could say plus 4 out of 4 reflexes. How about this? How about anxiety? How about this one? This is sort of the ultimate up symptom, seizure. That's like the ultimate up symptom because all your neurons are firing all at the same time. Okay. How about this one? Let's see, up. How about this? Diarrhea. Why is that up? How is that up? Because that's increased peristalsis. That's why. Increased peristalsis. Let's see here. How about spiked T wave? How about elevated ST segment? So you don't even have to know what a spiked T wave is. You just got to know it's an up symptom. You don't have to know what an elevated ST segment is. You just got to know, well, that's up. Okay. So these are examples of up symptoms, and you have to be able to recognize them. It's not an exhaustive list, but as the pH goes, so goes my patient, except for potassium. So if the pH is going up, you're watching for up symptoms except low potassium. Okay. All right, let's talk about down symptoms. Okay, down symptoms. So down. So this is acidosis. pH less than 7.35. So as the pH goes, so goes my patient, except for potassium. So I'm looking for signs and symptoms that are down, except up potassium, which is hyperkalemia. Everything else is going to be down. All right, so let's talk about down symptoms. So how about this one? Lethargy. Lethargy, not D. Bradycardia would be a down symptom. falling blood pressure, hyporeflexia, depressed ST segment, inverted, or could say flat. They're both down words. Inverted or flat ST segment. How about this one? Constipation. Why is constipation a down symptom? Because it's decreased peristalsis. Sometimes I spell words wrong, so just be gentle with me if I spell words wrong. Sometimes I do that. I know how to spell generally, but sometimes I just forget when I'm talking, you know. Let's see. How about, did I say hyporeflexia? Not sure if I said that. Hyporeflexia. Kind of worst case scenario is, their heart stops or breathing stops. I mean, that's, asystole. That's kind of, eventually, if you let it go, the heart's just going to stop. Okay, so those are examples of down symptoms. All right, I've got a Q&A here. Let me see what it says. So what if the bicarb is within range and the pH is either up or down? Annie, if you have a specific question you can give me, like if you've seen a question like that, if you've seen a question like that and you can find it, you wrote the example. I just don't think you would get a question like that. That's the reason I'm asking you that. It's because if the pH is down, the bicarb would have to be off because the bicarb is trying to compensate for that. It would have to be, unless there's some other reason why it couldn't for whatever reason. But I just don't think you'd get that question. So that's why I'm not going to take the time to answer it, because I don't think that would happen. Okay. All right, let's go to the next page. Page 2. At the top of page 2, it says, remember. Remember. Here's what I want you to remember. Remember McCuismal. So think, Mark Klimek has a neighbor from Scotland, and his name is Colin McCuismal. Okay, Colin McCuismal. So remember Mark's Scottish neighbor, Colin McCuismal. And the reason you have to remember that is because the M stands for metabolic, and the AC stands for acidosis. And you need to remember that Kussmaul's respirations only occur with metabolic acidosis. So if they give you a select all that apply question, for example, don't pick Kussmaul's unless they're in metabolic acidosis. Okay? So we've talked about 2 rules so far. First of all, we said the rule of the bees. If the pH and the bicarb are both in the same direction, then it is metabolic. And I said you use that when it says which acid-base imbalance is metabolic acidosis, right? They give you a bunch of numbers. You have to say which one is metabolic acidosis. Or they give you an ABG and they say, what is this acid-base imbalance? You just got to pick which one it is. That's when you use the rule of the bees. That is the most simple type of question that you can get as far as acid-base balance is concerned. You have to get those right. There's another type they can say, well, your patient is in this acid-base imbalance. Which signs and symptoms would you watch for? And you go, okay, as the pH goes, so goes my patient, except for potassium. Now, there's a third type of question that they can ask you. There's no blanks for this, but they can ask you a question like this. They may say, you're caring for an 8-year-old near drowning. Which acid-base imbalance would you watch for? Okay, they didn't tell you the acid-base imbalance. They didn't give you any numbers. They just gave you a scenario. So when they give you a scenario and they say, which acid-base imbalance would you watch for? That's when you use this third rule. Okay, they give you a scenario and they say, which acid-base imbalance would you watch for? This is when you use the third rule. So here's the rule, the gray box on page 2. First, ask yourself, is it lung? That's the first thing. Is it lung? If yes, then it is respiratory. If yes, then it is respiratory. So, and don't overthink it. Okay, don't overthink it. So, an 8-year-old near drowning, would you consider that lung? Yes, right? Because near drowning means they weren't breathing. Okay, so the answer then is yes. 8-year-old near drowning. You go, okay, that means you're going to cross off the metabolic answers. You're not even going to consider them. It's going to be a respiratory answer. It's either respiratory acidosis or respiratory alkalosis. It's got to be one or the other. Okay, so then you ask yourself, keep going in this gray box, then ask yourself, are they over ventilating or under ventilating? Are they over ventilating? Ventilating, did I spell it right? Over ventilating or under ventilating? If they are over ventilating, that is alkalosis. If they're under ventilating, that is acidosis. And that's, I'll let you write that down. If you think of the word over as an up word, if you think of the word under as a down word, then alkalosis is up and acidosis is down. So those things go together. So overventilating is respiratory alkalosis. Underventilating is respiratory acidosis. And this is really good thing to remember, because whenever they ask you, let's say they give you a question about, like, let's say they say your patient's on the ventilator and their morning ABGs show that they're in respiratory acidosis, right? They're on the ventilator and the morning ABGs show respiratory acidosis. You say, well, respiratory acidosis is under ventilating. So if they're under ventilating, that means what? Well, I have to increase ventilation. That's what I got to do. And it's a lot easier to know what to do for under ventilating than it is to know what to do for respiratory acidosis. So I don't know if you're like highlighting things as you're going through this book or putting stars or something like that, but I would put stars next to these two things. I would put next to stars to if overventilating, pick respiratory alkalosis, and if underventilating, pick respiratory acidosis. I would star and highlight those because those are concepts that are really important to remember and can really help you as you're taking the NCLEX. So in this case, if we have an 8-year-old near drowning, first of all, is it lung? Yes. Okay, so yes, it is. Are they overventilating or are they underventilating? Well, they're underventilating. So for an 8-year-old near drowning, I'd watch for respiratory acidosis. Okay. Now, let's say we get a different kind of a scenario. They say you're taking care of a patient in acute kidney failure. There's no blanks for this word, acute kidney failure. And then they say, which acid-base imbalance would you watch for? Okay, acute kidney failure, which acid-base imbalance would you watch for? So first you say, is it lung? Well, no, it's not lung. It's kidney. Don't overthink it. It's not lung. It's kidney. Okay, so that means it's not respiratory. All right, so you see the second gray box? If it's not lung, then what is it? If it's not lung, then it's metabolic. Has to be. So for if they say patients in acute kidney failure, what acid-base imbalance are you going to watch for? I go, well, if it's not lung, it's metabolic something. So I'm crossing off the respiratory answers. Not even going to consider them. Okay, if the patient, let's keep going. If the patient has prolonged severe vomiting or suction, pick alkalosis. Prolonged severe vomiting or suction, pick alkalosis. For everything else that isn't lung, pick acidosis. Acidosis. For everything else that isn't lung, pick acidosis. Okay. So this is acute kidney failure. Well, it's not lung, right? Okay, so it's not lung. So we're going to pick metabolic. Well, is it prolonged sustained vomiting or suction? Is acute kidney failure prolonged sustained vomiting or suction? And don't say, well, they could be. No, they couldn't be. This is important to remember. You only know what they tell you, y'all. You only know what they tell you. If they don't tell you they're vomiting, then they are not vomiting. Okay? So it's not prolonged severe vomiting or suction. So that means it has to be metabolic acidosis. Okay? And then it says when you don't know what to choose, pick metabolic acidosis. However, there really should not be a time, if you're using these rules correctly, there should not be a time where you don't know what to choose. Okay, let's keep going. Let's talk about ventilator alarms, page 3, ventilator alarms. We just taught this in class today. I just got done teaching this in my class. Oh, let me look at Q&A, what they say. Caesar says ventilation has nothing to do with respiration. Correct. Interesting question, Caesar. So let me tell you. This is what I just taught my students today. There's two different things. I want to give you the right word. Respiration, they say like respiration. Usually they're referring to oxygenation. But if they say ventilation, usually they're referring to carbon dioxide. So you could say respiration is oxygen, ventilation is carbon dioxide. So what do we have to do from a respiratory standpoint to get rid of carbon dioxide? What do we have to do? Well, if we want to get, if they have too much carbon dioxide, we have to increase respiratory rate to get rid of more carbon dioxide, right? So if they're underventilating, we increase the rate. If they're overventilating, we decrease the rate. Now, if they're talking about an oxygenation issue, then we increase the FiO2, which is the fraction of inspired oxygen, which is percent. It's the percentage of oxygen that they're breathing in. Like if we say they're on 30% oxygen, that's FiO2, 30%. So we're going to talk about that later though, so I don't want to get into that too much, but if you're asking how do you treat underventilating, you increase respiratory rate. If their O2 sat is low, you increase the percentage of inspired oxygen.